going to pay? So I guess what we'd like all of you to address is, in your experience, you come from all different diagnosis perspectives, different issues. What is the impact of cost that you see? How is it interfering with what we consider to be quality care? And what recommendations would you have to go forward, again, within your own particular world to try and address this issue?
I think, however, if you're going to talk about the cost of care, you need to talk about the healthcare system as a whole. And the problem I think that we face as advocates, and many of whom are survivors ourselves, and we work with survivors who have been trained throughout all of this that more is better. More is better, more treatment, more tests, more of these things. And when in reality, those of us who come to these meetings, we sometimes learn that more is not always better, and it costs a whole lot more. And so I think one of the biggest challenges that we have as organizations is, how do we speak to our constituents? And how do we educate our constituents that that's not always the case, and that's where part of our costs of care are rising? And how, and then how do you tell, women or men who really want that test that there's not really the evidence to back it up? And so it's really our job, especially as we become educated here, is to take what we've learned here and take them back into our communities and educate people on evidence-based care, and educate people on the fact that there are, so often our patients, our constituents, are so focused on getting through this cancer that they don't necessarily always think about what the treatment for this cancer might do to them 20 years from now. And most of them would say they don't care, because this is the problem they got to face now. But all too often, not only are we being overtreated in many cases, but it's overtreatment that not only costs a lot, but it's not just dollars. And so, for example, in the demographic I work in, which is women under 40, there are a lot of long-term side effects to this overtreatment that are popping up years and years and years later. And costs, the healthcare system, can't handle the burden of overtreatment. And I also think that it's not necessarily fair to our constituents that we know that there's evidence out there that shows that in some cases more is not better. And I think it's really up to us to do a better job to educate them and to work with physicians who are sometimes so afraid of, making a patient, unhappy, or if a patient demands this test and they say their insurance is going to cover it, they're just going to order the test instead of educating the patient on maybe why that test isn't necessary, or why it's not, what the standard of care is, or, teaching them about what NCCN guidelines are. And so I think that if we're going to really truly control costs, one of the greatest things that we can do as advocacy organizations is really take that message home that more is not always better.
We did a study in 2007 at the National Brain Tumor Society looking at the financial impact of brain tumors on families, because we were especially interested in this group, which often has a lot of long-term impacts beyond their sort of treatment period, because they can't return to work, or they may have difficulty from cognitive impairment. And what we found was that people were not able to get adequate resources to help cover MRIs, which is an important and critical part of follow-up for this population. People were not able to pay for the drugs that they needed to have in order to keep moving forward. And they weren't able to continue on paying for their lives, just their homes and all of those resources. And since then, we've looked a lot at quality of life in this population, because we're probably a little behind the curve in terms of, longer and longer survivors, but it's beginning to happen. And one of the things that we're seeing is that people do not get adequate coverage for any of the things that really have to do with what your life is like after you finish that last round of chemotherapy. You don't get help with the neuropsychological testing that you need to understand what's changed in your life. You don't get help with physical therapy or speech therapy in the way that you need to. And people don't get those resources, so they're not really able to move forward with the optimum survivorship. And I think it's important to know what resources there are to plug people into various funds and that sort of thing. But it's a much more important conversation, from my opinion, to look at the whole system and what we call standards of care, what we call sort of adequate quality cancer care. Because in a group like brain tumor patients, that really isn't happening at all systemically. It's only happening at very few centers, and most people are treated in the community and are trying to piece these things together without any adequate access to those resources. So I think on the overall, it's really finding ways to fund that survivorship care that's so critical for this population, and just in terms of value, because I think there are as many cancers represented in this room as there are cancers out there, and everyone's survival curves look different, and what is value to one group may be different to another group. I think it's important to understand that historically in the brain tumor world, 4 months is a big improvement. And that may not be the case in some other cancers, but we have to take those gradual steps where we can. And so value takes on a very different proposition because it's subjective. It changes from patient to patient. What that time means to one person is different from what it means to another. And I think patients need to be a part of those conversations in determining what is value for them.
I am concerned about the patchwork. And I know that we can find a whole lot of resources, and a really skilled person, a navigator, can find a lot of resources and try to patch this system here, that system there. What happens in Texas is very different than what happens in New York, what happens in Florida for a patient, or what happens when you are 85 or when you are 25 is very different. And understanding that whole system is a really difficult thing. It is impossible for a patient who is also concerned that they're ill and they don't feel good and they're sick to their stomach, or a caregiver who has a whole new burden that they're dealing with, to know all those resources. And how we simplify the system. Healthcare reform has helped, but it's also made it much more complex, much more complicated, more difficult to understand, and there doesn't seem to be any desire to make things simpler. And so we need two things. We need some really skilled patient navigators that are social services and financial navigators that are not really worried at all about treatment issues. And we need to make the system simpler.
I think part of the solution needs to be that all of us who are working with cancer patients need to be doing more. At a minimum, we know that there are resources out there. We know that for many of those resources, they are not being tapped. They are not being tapped to the maximum degree. So I think as a small starting point, frankly, all of us who are working with cancer patients need to make an effort to educate patients and families about the resources that exist, that are out there, getting them connected with these resources and helping them through our social workers, through case management, through navigation, get connected to these resources, so that I think let's get to a point where folks are telling us those resources aren't there anymore. Now we need to go to the next step. But in talking to pharmaceutical companies and talking to some of the charities that do copay assistance, we know that there still are dollars remaining that can be taken advantage of from patients. So I think there's continues to be a real educational opportunity here with regard to the cost of care.
The reality is, I think we, as a group, we need to focus a little bit more on making more effective and swinging for the fences and being more aggressive at this, and that will dramatically reduce the cost of cancer care, and thus we won't be arguing about what it costs. It'll be a matter of how much we won if we do win in this battle.